Hello everybody, my name is Inigo Iriarte. I will talk about lateral ligaments of the ankle, and I will start my video with a small reminder about lateral ligaments anatomy. So, there are several ligaments in the lateral aspect of the ankle, but the most important by far is the anterior talofibular ligament. This ligament starts in the anterior side of the fibula and with an horizontal direction. The direction of this ligament is the same direction as the sole of the foot. So we must place the probe with this direction to have a good view of this ligament. Don't forget there are usually two bands of this ligament, the superior one and the inferior one, and sometimes this inferior one has a bridge with the calcaneofibular ligament. Okay, so if you are searching this ligament and you have a nice view of this ligament, don't forget to go upwards and downwards till you if you don't, sometimes you will lose pathology. Okay, so this is the first ligament we need to check. And okay, to do so, we will place the probe over the fibula, and then we will lie over the talus. In this with this orientation, if we are parallel to the sole of the foot, we must move the probe downwards and upwards, and we need to see this image with the fibula here and the talus. This black image is the cartilage, and you can see between the fibula and the talus this hyperechoic structure here. This is lateral fat, usually hyperechoic, and this is the first image you need to see. Once we have this image, if we are properly oriented with the same axis of the sole of the foot, then we move the probe upwards and downwards till we see a tense ligament, as you are going to see just now here, with these fibers, and this is a normal ligament with this slightly hypoechoic image. If we compare with the fat, with this fibrillar pattern, okay, and this is the image we must seek. Below we will have the capsule, the joint, because this ligament is a reinforcement of the capsule. Okay, so this is the anterior talofibular ligament. Don't forget to go upwards and downwards to check all this area. Okay, once we have checked this ligament, then we must check the second ligament, the anterior tibiofibular ligament. This is a component of the syndesmosis and stabilizes the syndesmosis. Okay, the affection of this ligament is called the high sprains of the ankle. So once we have the anterior tibiofibular ligament, we turn the probe 45 or 50 degrees upwards, and we will be between the fibula and the tibia. And if we are properly oriented, we should see this ligament. Okay, this ligament has again two components, an inferior and superior. Okay, and this is very important because you must notice the affection of this inferior one. It will cause this. If it's affected, it can cause. Okay, just forget it. We will continue. Okay, and we turn the probe 45 or 50 degrees, and we will see this anterior tibiofibular ligament. Okay, and this is the image. This is the fibula. This is the talus, and once we turn the probe 45 degrees, we'll have this image between the fibula and the tibia. As you can notice, we we start at the talus, and the talus disappears and the tibia appears here, and this is the image we must reach. Anterior inferior tibiofibular ligament. But there are other ligaments we must check. With the same mechanism of lateral sprains, we also can have the calcaneocuboid ligament and bifurcate ligament injured. In the Chopard joint, these two ligaments are also very important and usually are forgotten. So, if the patient complains about more anterior pain, not at the location of the anterior talofibular ligament, but distally and inferiorly, always check these ligaments. You can have a very good image with high resolution ultrasound, and it's sometimes difficult to see these ligaments by MRI. So you start placing the probe over the hyperechoic cortical of the calcaneus, and then go distal till you reach the joint between the calcaneus and the cuboid bone. Once you are there, then you move the probe upwards and downwards till you see a very thin very thin image, which will be the dorsal calcaneocuboid ligament below the pedius muscle. At this level, this ligament, the dorsal calcaneocuboid ligament, is very thin. Is wide but very thin. Okay, this is the dorsal calcaneocuboid ligament, this ligament here. And as you can notice, this image here is very subtle. It's very subtle. Okay, and because it's a normal one. If it's injured, you will notice a thicker hypoechoic ligament, and it's easier to see. This is the pedius muscle, this is the calcaneus, and this is the cuboid. Once we have checked this ligament, we can go upwards till we see the second ligament in this area. This is the bifurcate ligament. The bifurcate ligament has two components: the calcaneocuboid ligament and the navicular component. Okay, it's very important to check its insertions in the calcaneus bone, because usually the pathology will be here. And this is the image with ultrasound. This is the calcaneus. This is the margin, the edge, the superior and exterior edge of the calcaneus. This is the cuboid bone on its dorsal aspect, and you can see this very thin ligament here below the pedius muscle, and this is a normal one. It's surrounded by the fatty tissue, hyperechoic, and again, if it's affected, it's injured, you will see a thicker hypoechoic ligament. Is easier to see. Okay, always check the integrity of the cortical of the calcaneus and the cuboid bone, because very often the ligament will be with edema, but you will have an avulsion of the bone itself. It's very common to see these images here. Okay, so always take a look at the cortical of the bones of the calcaneus and the cuboid bone. Okay, the talonavicular ligament. This is another ligament that is worth to check it, because this time is not in the inversion mechanism, but in forced plantar flexion. Okay, and this ligament can be injured in these movements. I usually start placing the probe over the tibia, and I checked the anterior recess of the joint. Once we have checked there's no fusion inside the joint, we move distal till we see the head of the talus and the navicular bone. And here we can see this ligament. It's a very wide ligament, okay, between the talus and the navicular bone. And again, usually its normal shape is a thick hyperechoic fibrillar pattern, and it's swollen, hypoechoic, or with edema. It's because it's torn or injured. Okay. And to finish, the calcaneofibular ligament. Again, the anatomy. The calcaneofibular ligament is a narrow ligament, narrow and long ligament. Its origin is in the fibula, in the tip of the fibula, and usually has a posterior, slightly posterior direction, and inserts in the calcaneus. Okay. Sorry. It has a close relationship with the peroneal tendons. Peroneal tendons go below the tip of the fibula, below the lateral malleolus, and when they turn lateral, they pass just above the calcaneofibular ligament here. So they have a very close relationship. And if we follow the peroneal tendons, once we see the peroneal tendons and we see the cortical of the calcaneus, between the cortical and the tendons, we will notice this ligament. Okay. Why I speak about this ligament, the later one? Okay, because I usually perform the evaluation of these ligaments with the patient in a supine position with the sole of the foot over the table. Okay, and in this position it's very easy to check the anterior talofibular ligament, the anterior tibiofibular ligament, the dorsal calcaneocuboid ligament, the bifurcated ligament, and the talonavicular ligament. But this ligament, we must change the position, and this is why I use a different position, and this is why this is the last ligament I check. I ask the patient to extend the knee. I place a pillow between the leg and the table, and the foot is free. So I can place the probe laterally without having problems with the table, and it's very useful because I need to ask the patient to force the dorsiflexion of the ankle, and that's because in this position the calcaneofibular ligament gets tense. When the patient is not in this position, the ligament is not tense, sorry, and it's very difficult to check. So we ask the forced dorsiflexion, then the ligament gets tense, pushes the tendons towards the probe, and it's easier to see. Okay. We place the probe, we move the patient's ankle, and as you can see here, the tendon becomes tense and pushes the tendons. The ligament gets tense. And this is the video of this maneuver. We follow. These are the peroneal tendons. Okay. We follow the tendons. You can see here the cortical of the calcaneus, and there's something here between the peroneal tendons and the calcaneus. Something here is very with a bad view, a bad image. This is the calcaneofibular ligament here. So we need to ask the patient the dorsiflexion, and then it becomes tense, and we can see a fibrillar pattern, a very good fibrillar pattern, and we can see how this ligament pushes the tendons superficially, and we can check this tendon very accurately, this ligament, sorry, very accurately. Okay, and that's all. That's the explanation about the lateral ligaments of the of the ankle and how to explore them. Hope you find it useful and you try to check all these ligaments. Don't forget the calcaneocuboid, dorsal calcaneocuboid ligament and the bifurcate ligament. They are very important and usually forgotten. Thank you very much.